Nicola Hill, who joins us now from London. Nicola, good to see you. I looked at the report and it really struck me that it says the mental health needs of survivors of severe COVID infection need to be taken as seriously as their physical health needs. It is so important, isn't it?
Oh, it really is, Maria. And I don't think it's that surprising, actually. I mean, the whole population has been affected as far as their mental health with the lockdown, with the isolation, with the restrictions that have been put in place. But it is particularly these people who've been hospitalised with severe COVID that's worrying mental health experts. There's an organisation called the COVID Trauma Group that's been set up by experts here in the UK and Haifa University in Israel. And they're the ones who are saying that we need to have these screening guidelines for post-traumatic stress disorder. Normally you see this when people have been involved in bombings, natural disasters, but also in previous health epidemics. And they're saying these guidelines should be put in place now. The head of this group, Dr. Michael Bloomfield, he fears that as many as 1 in 3 patients who've hospitalised with COVID-19 are at risk of post-traumatic stress disorder, PTSD. Another 15% are likely to have anxiety issues, another 15% depression. And he's saying this is because for the people who have been in intensive care in particular, you know, they worried, the fear that they were going to die, the fear they were going to have long-term health implications. And of course, whilst they were being looked after, they were being cared for, you know, extremely well, but by people wearing full PPE. And I've been speaking to intensive care nurses in particular who ordinarily would be sitting with patients, would be holding their hands, would be smiling at them, would be trying to make them feel better with that human contact, which of course during the pandemic they've not been able to do. And this is why Dr. Bloomfield says it's really important that before anybody leaves hospital they should have a full psychological assessment, and then this should be followed up a month later and then up to a year later. Because he said that when there was the SARS epidemic, about 60% of people did have mental health problems afterwards. And also when people normally leave intensive care, because it is a traumatic thing when you've been at death's door, up to 20% of people have already had PTSD. So that's why it's something that he says we really need to be aware of.
So important and maybe overlooked. Nicola, talk to us as well about the impact on mental health for people that weren't necessarily in hospital but have been at home for months, alone, not seeing any humans sometimes, not having that human contact.
And I think it's been dreadful, hasn't it? I mean, if you think of the people who've been shielding, you think of the elderly, you think of the vulnerable, they've been stuck in their home, you know, if they have had access to the type of technology we're using today, whether it's Zoom, whatever, then that's something, but it's still not physical contact. And in fact, some research has been published in the Journal of Neurosciences saying that loneliness can actually affect your brain. They did a study on students from Dartmouth University, about 50 of them, and they showed that the front part of the brain, it's the social part of the brain, the medial prefrontal cortex, actually changes in people who are lonely. And obviously this is a fear, you know, what impact is it having on the rest of us? I mean, I don't know about you, but I can't see my sister, for example. She lives in Wales, and in Wales you're only allowed to travel 5 miles. And from England, I can't go into Wales. Might be minor because I've got other family members that I can meet up with. But it definitely has an impact, doesn't it? And you're not seeing your friends as regularly. You're not just having normal social interaction. And we know that social interaction is so vitally important for our physical health as well. It can reduce cancer, it reduces heart disease. And also there were some statistics that have been published here in the UK from the Office of National Statistics just this month, with 7.4 million people worried about their well-being because of loneliness, which I think are really quite horrendous statistics.
They really are, and it's good to talk about this. And I learned so much when I when we speak to you, Nicola, that loneliness also affects your brain. That really is incredible. Nicola Hill, thank you so very much for that.